Hi, Miss Ngon. Nice to see you today.
Hi, nice to see you.
Okay, now let me verify your name and your birthday just to make sure that I have the right patient today.
Okay, my birthday is July 26th, 1994.
Thank you. Now what brings you into the clinic today?
I have had a light headache recently, and I am in my second trimester of pregnancy. So I am concerned for my health, and plus I'm diagnosed with diabetes.
Okay, sure. Let me ask you a few questions regarding about your blood pressure. On top of that, I will also go over some of the labor teaching beforehand. And if you have any questions, please let me know.
Okay, thank you.
Okay, so let's start with your headache. As earlier you mentioned that you do have headaches. Do you know what your blood pressure level is?
It's about 135 over 90.
Okay, well, that's kind of high, in my opinion, um, compared to last time I saw you. So what it is high blood pressure during pregnancy can be dangerous because it could lead to preeclampsia. The symptoms is, headache, vision changes, abdominal pain, edema, especially, your face or your hands are swollen. But since you're having a headache, we'll go ahead and do some blood tests and urine tests just to make sure your liver and your kidney are, work or function well. We will also do a non-stress test today just to hear your fetus movements, heartbeats. We'll get some blood tests done. And carefully monitor your fetus growth. And if there's preeclampsia occurs, unfortunately there's no cure for this, but it is most likely that you will have to do a C-section. And I would recommend you to bed rest, just to prevent any complication in the future. Also, take your blood pressure medication as your doctor order. Keep your balanced diet and do your exercise on a moderate level.
Okay, that makes sense. And I also have another question regarding about the breastfeeding.
Okay.
I have a problem breastfeeding with a previous child, and could you show me the technique of how to breastfeed again?
Okay, yeah, no problem. So, with an infant, when newborn, when you're breastfeeding them, it's important for you to, have them face you, belly to belly fashion, with with the baby's mouth open in front of the nipple. You kind of have to use one hand to hold the breast, with a thumb position on top the fingers, below, areola. Um, you should also, rub the newborn lips gently, with the nipple, and then the newborn should open his mouth, and it should cover the nipple about 2 to 3 centimeter surrounding the areola. You should expect the newborn cheeks, nose, chin to, be touching with the breast, and you should feel the pulling sensation when the newborn is, sucking on your nipple. You should also feed the newborn about 8 to 12 times a day, which is like every 2 to 3 hours. Um, and while breastfeeding, you should alternate your breast, with each feeding, just to make sure you're stimulating each breast equally for milk production.
Okay.
Okay, so that's okay for you. Okay, now I also want to add a few stuff before the labor, which is infant safety. Then it is important for mothers to learn the skills of feeding, clothing, bathing, protecting their infants before they leave the hospital. So for infants, what you should know is, for the umbilical cord, you should keep the cord clean and dry. Don't secure the diaper too tight over the cord because the cord eventually, will fall by itself. You should report if there's any swelling, redness at the base of the stump, purulent drainage, or like a full odor from the stump. And then for circumcision, you should observe the penis if there's any bleeding. Always clean the penis with warm water and apply the diaper loosely. You should expect to see the yellow exudate from the glands the first 24 hours, and that could last to 3 days. And you should not remove it, just leave it alone. And then when you see a minor bleeding on the penis, just gently pressure the penis from the sterile gauze. And then moving on to the bathing the newborn, you should always, start off with a sponge bath until the umbilical fall off. You should never leave the newborn unattended or alone during a bath. Always clean the newborn, each urination and bowel movements just to prevent, diarrhea rash. And then for, clothing, you should dress the infant for comfort. Swaddling in a blanket provide them feeling secure, and help them to maintain the body temperature. And do not leave any stuffed animal, loose bedding in the crib just to prevent suffocation. You should keep the crib away from the heater, and then use a firm mattress for the infant, covered with a sheet. So do you have any questions regarding about the infant safety at all?
No, I'm okay.
Okay, cool. And then earlier you also told me that you have diabetes. And could you tell me your concern regarding about that?
Yeah, I want to know if I should do a moderate exercise daily to help with my diabetes.
Oh yeah, definitely. It is one of the requirements for gestational diabetes mothers to do, and also keep the balanced diet. Meaning just you should avoid high sugar food. You should eat reasonable portions of high carbohydrate, such as milk, yogurt, fruits, beans, pasta, potatoes. Those are very good options. Just to remember to eat like a smaller meals, but more frequent meals. And then you should also check your blood sugar at least 3 to 4 times a day after starting your meal.
Okay.
Yeah.
Yeah, thank you. I understand and I have better knowledge about it today.
Okay,
Thank
yeah,
you.
you're welcome. I hope you feel better, and I hope that I answered most of the questions for you today. Feel free to call me anytime you have a question.
Okay, thank you.
Okay, thanks.
Bye-bye.
Bye-bye.